I'm Marius, a British student. Actually, I'm here to demonstrate a series of exercise, cardiovascular testing, flexibility and balance assessment, and strength and endurance assessment, including blood pressure measurement, skin fold measurement, gait measurement. I will start by measuring blood pressure, and to do so, I have a willing participant called Julie that I'm going to introduce to you. Good morning, Julie. How are you doing today? Okay, this is Julie. I will measure your blood pressure. Before I do so, I will clean my hands. So, to take blood pressure of a Julie, I will use the stethoscope and the sphygmomanometer. I will apply or place the sphygmomanometer on the upper arm of Julie, approximately 2 fingers above the elbow joint. Then I will inflate the cuff right up to 220, 240 millimeter of mercury to check the systolic blood pressure by palpation. Now I will release the valve rapidly to check the systolic blood pressure zone. Okay, the systolic blood pressure zone was around 120 millimeter of mercury. Now, I will take the blood pressure by examination. To do so, I will place the belt of the stethoscope on the artery and inflate the cuff up to 160 to close the brachial arteries. And then I will release the valve slowly. The first sound will be the systolic blood pressure. Alright, the first sound was heard at 120 and the monthly point at 80. So the blood pressure is 120 out of 80 millimeter of mercury. It's important to measure the blood pressure to know whether the client needs to be cleared before commencing an exercise program. We will continue with the skin fold measurement. To do so, we have some several sites that we're going to measure: the triceps, the ilium, the abdomen, and the thighs. To measure the skin fold, I have the caliper over here. And once I open the grip of the caliper, the needle will show the skin fold site. And we record the centimeter skin fold. Now, we start by measuring the skin fold of the triceps. To do so, I will find the midway of the triceps between the acromion and the olecranon process by using my fingers. So the midway will be here. I can use my marker. Yes, thank you. I will use my marker to mark the point between the olecranon and the acromion process. The midway of the skin fold, the tricep will be here. And I will use my thumb and my forefinger to test the sensitivity of the client. Your arm needs to be relaxed. I will test the sensitivity of the client, not to hold the muscle. Now I will check this vertical fold. And then I will place my finger, I will place my caliper just over here, and we get there at 5. So the tracet is 5 millimeter. We will have to do the reading twice for accuracy and reliability of the measurement. So we will continue again to take the same measurement of the tracet to make sure we compare with the first reading. Above 2 millimeter difference, the measurement is likely to be poor. The arms need to be relaxed. Okay. All right. The measure is 6 centimeters. We will continue with the ilium. We continue with the ilium. So to get the midpoint, we will use our finger, the last finger and the forefinger, just above the ilium crest. And I will get my marker to get the midpoint over here. So the diagonal fold, I will still test the sensitivity of the client to avoid to grab the muscle. Then apply my caliper, which is 13 millimeter. We will take again the reading for a second time, to evaluate the accuracy and the reliability. Still, I have to palpate and test the sensitivity before taking the skin fold, not to grab the muscle. 13 millimeter. Okay, we will continue with the abdomen. The abdomen will be just 2 centimeter from the umbilicus. To do so, I will use my tape to get my mark will be right here. Okay. So I will take the vertical fold. You better need to be relaxed. Still, I will test the sensitivity of the client to make sure I don't hold their muscle. Shows 19 millimeter. Then we will still get the reading for the second time, as explained previously. The belly need to be relaxed. All right. $19. We continue with the tight, and to find the midway of our tight, we will check the hip, the midway from between the hip and the upper posterior. Now we will continue with the tight measurement, and to do so, I will find the midway between the hip and the upper anterior patella by using my fingers. Here we can find our midway over here, where I will put my mark. So I will get the vertical skin fold. The vertical skin fold still by testing the sensitivity of the client to make sure we don't hold their muscle. 14 millimeter. We will take the second reading for accuracy and reliability. Now that there's body composition in on, a rating will be derived from the relevant table of age and gender by matching. We continue by measuring the circumference of the body. So we will measure the waist, the hip, and the mid-thigh. To do so, I will use my tape, cloth tape, which is the easiest way to measure circumference of the body. To do so, I will take the horizontal measurement at the neutral narrow of the hip. We have here 77 centimeters for the waist. Now we will continue with the hip. Just stand on the side. So we will take the horizontal plane of the posterior protuberance, the largest protuberance of the buttocks, once the client is viewed on the side. Here we have 93 centimeters for the hip. Now we continue with the tight. The mid-tight, to get the mid-tight, we will find the midpoint between the acromial and the upper anterior patellar. So we can find our midpoint over here, which I can use marker to mark it. Thank you. Here we have 50 centimeters. So, although the circumference measurement doesn't give body composition, but changes really happen quickly in comparing to skin fold measurement. And the accuracy is very useful as for specific factors. Now we continue with the flexibility and balance assessment, which consists of two exercises, sit and reach and static flexibility. We start by sit and reach assessment. The purpose is to evaluate the hip flexor flexibility as well as the low back and the hamstring muscles. To perform the exercise, I will have the box, which is at 28, my 0 is at 26, where normally I will sit and place the heel of my foot firmly close to the box. And I will put my hands one on top another one until the tip of my fingers are aligned. And I keep my knee straight on the ground. And before doing this exercise, we need to warm up, because warm up is very important. By doing warm up, you will prepare your body, and then you will improve performance and reduce injuries. So I will place my hands on top another one and make sure my fingertips are aligned, and I will bend forward smoothly, and then to the high level, and then come back slowly. We have 3 triad, and the best score will be the one we recorded. So, désolé, you have to sit. All right. Your knee must be held with the box. You have to make sure, since you warm up already, now you put your hands, your low back and your head must be aligned. Okay, your finger aligned as well to the tips. You have to bend slowly, and move forward. Bend slowly and move forward. And hold for 3 seconds. Perfect. It shows plus 3.5 centimeters. So you have to continue again. For the second one, you have to make sure your back and your head must be aligned to avoid injury. So continue, and I will make sure your knees stand straight on the ground. To be aligned is very important. You have to push yourself forward forward. Oh, you hold 3 seconds. 1, 2, 3. It shows +4. So the last here, you breathe. You have to ensure also correct breathing because it's very important. When you breathe, your performance can be improved. We go for the last try. Slowly, gently, not to injure your lower back and your hamstring as well. Your knee needs to be on the ground. That's perfect. Push yourself and hold 3 seconds. 1, 2, then 3. Perfect. It shows +5. That's great. So normally the sit and reach test normally after the 3 try must show improvement. So now we will do the static flexibility test. That the purpose is to monitor the development of the shoulder and waist flexibility. And to do the exercise, I will need 30 centimeter ruler with a tape as a measurement, and I will lie down in a prone position with my head nose on the floor, my body and my hand fully extended, and I will try to lift up the ruler right to the hand level, which will be recorded. And when I'm done, I will take the measurement from the acromial process to the long finger tips. And that's a measurement. I will subtract the iron score from the shoulder and waist flexibility I've just done. That's the procedure. And normally, the comparison will show improvement between all the previous tests. So, generally, you have to come. I think you have me. Okay, lie down in the front position. Exactly. You have to come. Behind, come behind me. Okay. You have to lie on your nose on the ground. Yeah. Here, you have the ruler in your hand. Alright. So, and I will take the measure at the 5 millimeter, the nearest 5 millimeter. You have to lift it up. Alright. Alright, continue. It's perfect. It's perfect. Alright, we will assess this again because I didn't get the right measurement. Here we go. Perfect. Perfect. And as you can see, it's very important. Warm-up is very important because when you do warm-up, definitely your body is prepared and the performance is improved and even reduce risk of injury. So, Jedone lift up to 27. So, Jedone, you will come, Jedone. Come with me, Jedone. What I will do, I will measure the length of Jedone arm from the acromial process to the long finger tips, which is 77 centimeters. So we take 77 centimeters and subtract 27, which is 50 centimeters. So, by doing the exercise, normally we will show improvement comparing to the previous text. We continue with the cardiovascular assessment, and we do the 3-minute step test. The purpose of this exercise is to measure the cardiovascular level and how, based on how quickly your heart rate can recover after exercise. So, to perform the exercise, I will need my stopwatch that I will set for 3 minutes, and I will need the metronome as well, which is already uploaded in this mobile, as you can see. Now, and we will need also the box, the modified box over here, 30 centimeters high. So, generally, this is the example. At the moment, we start. We follow the metronome as explained for 1 cycle. This is the move. You stand straight, both legs on the box, and down as well. This is the move for 3 minutes. After the 3 minutes, then you are done. You will come and sit over here, so that I will take your pulse within the 5 minutes. Within the 5 seconds for 1 minute. Alright? Okay. If you got the exercise, when you start, I say start, then you will start. So we have to set back our metronome. At 90 beats per minute, and set our time for 1 minute for 3 rounds. Okay, so are you ready? Okay, and to do the exercise normally, we need to warm up, because warm up is very important. When you warm up, you make sure you prepare your body for the exercise, and you improve balance, performance, and also you reduce injury. So, as generally as already warm up, we will perform the 3-minute stepping test. Here we go. You have to breathe. 1 minute, 2 minutes to go. You have to ensure correct breathing to make sure you bring the oxygen that your muscle needs to perform the exercise. Oh yes, that's great. Keep breathing. Ensure correct breathing. It's very important when you're performing cardio respiratory. 2 minutes, then 1 minute to go. Keep breathing. It's very important. Ensure correct breathing. Five seconds left. Done. Okay. You can come over here and sit. Okay. So that I will take your pulse, your heart rate, between there for 1 minute. Perfect. So you have the heart rate at 997 beats per minute. So as you get the heart rate, we compare it to the table of norm relevant to age and gender matches. Yes, we will continue again with the cardiovascular assessment, this time by doing the award test. The award test purpose is to determine the client fitness level. So, to perform the exercise, we will need the stopwatch and the gym bench that I will modify by using this chair of 45 centimeter well measured. So, and we will step on the chair. We will step on the chair every 2 seconds for 5 minutes. And after completing the test, I will take the pulse of the client for after 1 minute, the second pulse after 2 minutes, and then the third pulse after 3 minutes. And then I will divide 3,000 with the first, second, and third pulse to get the score of the client. So the watch will be set at 1 minute for 5 rounds. And this is the exercise. Every 2 seconds, I step on a chair. This way for 5 minutes. So we will start the exercise journey as I've just shown you, and you need to warm up. As you warm up already, definitely your hamstring will be always ready to perform the exercise. Even your quad as well, as you lift your head high, and definitely the warm up also improve performance and reduce risk of of injury. So, generally, you have to start. When I say start, you start. 3, 2, 1, go. Good job. 4 minutes left. Once again, 2 minutes left. Now you have 4 minutes left. Ensure correct breathing. It's very important. Ensure correct breathing. Keep breathing. It's very important to provide oxygen that your muscle need to perform the exercise. Careful. You have to breathe. You have to breathe. Too many left. Yeah, keep on going. Keep breathing. Very important. That's the good job. Keep on going. Keep breathing. Keep breathing. It's very important. 1 minute left. Awesome. Wow, that's perfect. It's good. Keep going. 10 seconds left. Awesome. 5 seconds. And that's all. Perfect. Give it in. Perfect. Come on, see it. So, I will take your pause after 1 minute. So it's very important to measure the fitness level of the client. In case maybe the client needs to be referred to a doctor before engaging himself into an exercise program. So we have 20 seconds left to take the first pulse of a journey. Then the first was 86. 86. Now we wait after 2 seconds, 2 minutes again, then we take the second pause. We have the second pulse at 91. We wait after the 3 minutes and we take the third pulse. That's all. We have the last pulse at 74. So the first pulse was registered at 86 beats per minute, and the second pulse 81 beats per minute, and the third pulse at 74 beats per minute. So to get the score of Dieudonné, we have to divide 3000 by 86, 81 plus 74. To do so, then we have so the score is 20. So Dieudonné scored 20.4. Again, we continue with the endurance and strength assessment. And to perform this assessment, we will do sit-ups and push-ups. Now we start with push-ups. Push-ups normally is to strengthen all the muscle of the core so that you improve your balance and the strength of your core, of course. So generally, this is the way to do the push-ups. You have to put yourself on the upward position and make sure your foot are on the tips of your toes, your hand lightly wider than the shoulder, and you drop down. You have to make sure your head and your back are aligned. 1, 2. You have to do 1 minute push-ups. That's 1 minute push-ups. And then the result will be derived from the rating term of age, gender matching. So we start by doing the push-up. That's the upward position. It's quite good. Okay, I'm going to say start. You will start. Okay. Start. 1, 2, 3, 4, 5, 6. It's quite normal. You have to keep breathing. It's very normal. You can see all your shoulder and your lower back, they're all aligned. That's perfect. That's normal. So we continue with the strength and endurance assessment by doing the sit-ups and the push-ups. So to perform the push-ups, we need our mat, which is here, and we need also the stopwatch and the recording sheet. Now, to perform the push-ups, the sit-ups, you have to sit on a mat, on a supine, lie down on a mat, on a supine position. Then, bend your knee at 45 degrees and make sure your fingertips are straight on the ground facing forward. And you will call up by placing your hands behind the head, the way they can touch your ear. And you call up by using the left elbow to the right knee. This is the exercise. Alright, so today you have to come and sit. You will lie down. The procedure is to do as many push-ups as you can in 1 minute. So I will set the metronome, my stopwatch for 1 minute. So that for 1 minute I will set the stopwatch and you will lie straight, and it's very important, especially when we such assessment or such exercise, because warm-up will help you to prepare the body and to make sure you improve performance and reduce injury. By performing the push-up to the knee, you will avoid to use your hip flexor. So make sure you use only your abdominal muscle. Concentrate on your abdominal muscle and you keep breathing always when you call. It's very important. So you will do as many push-ups as possible. But the moment I say start, alright, you have 1 minute, 1 minute, you do as much as possible. Here we start. Go. Perfect. Well done. So, the score of Jubilee is 18 push-ups per minute. And we compare the score with the rating on the relevant table of age and gender. So gender identity 18 sit-ups in 1 minute, and the rating will be derived from the relevant table of age and gender matches. So guys, we have come to the end of the assessment, and you all have seen how modify all the equipment to perform the assessment. Meaning what? Either you are in a gym environment, at an open place, in your room, wherever you are, any activity that can increase your heart rate is very important, because it will keep you fit and reduce coronary heart diseases. And I hope to see you again very soon, guys, for the next chapter.